Hello, everyone. Welcome to the Healers in Healthcare show, the Halloween episode. And this is Amy Behimer, who you'll meet. I'll introduce her shortly. And we're not dressed up. I am a pregnant person. That is what I am this this Halloween. We were just talking about, like the number of kids that come trick or treat. I'm sure my block is just filled with kids, so I'm sure we're going to have tons of them, and they're going to be disappointed when they find out like we run out of candy, but oh well. We're here. So if you are just joining us, welcome. I am just going to double check that we are live. Perfect. Okay, there are smiling faces. I see it on my phone, and I am really excited to dive into this episode specifically because we have never had this topic before, and I was so excited to bring Amy on today because we connected actually through another group. And she was like, wait, you're a pharmacist. I'm a pharmacist. So we were in this big podcast group. But before I go into, like I said, introducing her, I wanted to share a couple quick things about the Healers in Healthcare show, a little bit more about the mission and the movement of why I started this. And I always talk about that first book, actually this is book number 5, but the book that it was an anthology, my first anthology with 19 different pharmacists that are in this book. So Moving Beyond the Counter, this came through in my mind's eye as something that I wanted to bring forth as a creative project last May. So May of 2022. I can't believe it's almost 2024. And the reason why it came through as a download. I get these intuitive divine downloads as all of these women coming together. Sorry, guys, pharmacist men, maybe for the next book. But I wanted to bring all of these women together to show what's possible when you move beyond the counter. And so, you don't have to be a full-time entrepreneur. A lot of the women in this book aren't full-time entrepreneurs. That's okay. But they've also pivoted in their career and they've gone through maybe their own transformation, their health transformation, or helped a parent or somebody else through something that is essentially helping them heal. So we all know that, medication and conventional medicine does not heal. It masks symptoms, it suppresses, we know that. And so the women in this book and beautiful people that I'm bringing on this show are really out of the box thinkers, and they're spearheading this movement of helping their patients to heal. And so I want to bring people on like Amy who can show you what's possible when they branch out and do different things. So Amy's going to talk about how to create health and happiness even when there's an autoimmune diagnosis. We've had many different people on this show. And so I love bringing in these brilliant minds to showcase what's possible, because I know there are so many pharmacists out there that are like, and even with the walkout, right? There was a huge walkout that happened. I don't follow it that closely, but yesterday, because pharmacists are wanting to use their gifts. They're wanting to move beyond the counter and start helping their patients, having more time, intentional time to help them implement lifestyle changes or stress management techniques or whatever that might be. So we are here, and it all started with this book, with this movement to show you what's possible, because when we start healing and owning our gifts, then you can go be the beacon of light for your community and spread the domino effect of healing in the world, right? Because I am one person, Amy's one person, but if we all come together and we start to awaken these gifts that we have within us, and we can own those gifts to help these people that are out there waiting for your magic, that's when we can truly create this movement and domino effect. So before we start, I did want to highlight one of my incredible clients, speaking of people doing amazing things in the world. So Kim Kumabe is one of my clients. I'm going to cover my face here. And I wanted to shout her out because when I saw this project, it really spoke to me. And Kim has been a client of mine for a while now. She's been in my Elevate Healers Academy. She's also in Pristine right now. And, she has, breast cancer in her family. So her grandmother, her mother, her aunt are breast cancer thrivers. I love how she said thrivers. And, while her grandmother has passed, what she's done is now she's creating these cancer care kits. and I actually donated last night. So when you go to this post is in Monetize Your Magic. I wanted to highlight this for everybody. You can donate any amount. Kim lives in Hawaii, so you can Venmo her, and she's going to be creating these care packages for cancer patients. So there's going to be, everything that somebody going through chemo would need. So like ginger chews, like lip balm, all of these very intentional gifts that she's put together into these beautiful care packages. So if you feel called to this, I know we're kind of wrapping up breast cancer awareness month, but if you feel called to donate any amount, that information is in the post here. So I will, I think I tagged everybody actually in the group this morning. So I just wanted to highlight her. I am super proud of her for just, I always say, operating from integrity, intention, and love. And that is just such a beautiful way to turn pain into purpose and help her community. So I did want to just give Kim Kumabe a little shout out. So I don't know if that's her joining right now. I see some people joining here. And I am actually going to bring up the comments in case anybody has questions for Amy. And now I'm going to turn it over to Amy and introduce her. Actually, I'll let you introduce yourself. I love how we're both rocking headbands today. I didn't put on my nice shade of what is that, like a nice like rouge on your lip right there.
A little gloss, and I'll tell you, it doesn't come out often. So this is
Oh, special occasion. I love it. Well, thank you so much for being here. I'll let you kind of introduce yourself and what you're up to.
sure. And I love a chance to highlight. You kind of mentioned that we are out there healing. I'm going to use the term messy middle in the most loving way, where I actually am working full time as a pharmacist,
Mm-hmm.
and in this middle between adding in this healing role as a health and a life coach, helping people who are diagnosed with autoimmune disease, both the things that we can be doing from an environment and lifestyle stance, but depending on the diagnosis, it can be life altering, it can be life shattering, it can feel really heavy, some of these diagnoses, and we can get into what some of those may be. And so a lot of it is, how do we approach our relationship with it? And, as you mentioned, create health and happiness even with it. That's because when I was diagnosed with multiple sclerosis 12 years ago, I had my pharmacy school training. I had the graphs of the 4 types of MS,
Right.
and it was chronic, neurodegenerative,
Progressive.
progressive. It's these words that are scary, and there's no positivity linked anywhere in it. And so when I was diagnosed, I really thought that my life would never be not only the same, but never be as good. It would
Mm,
always be this, and with MS. And it's 12 years of, I'm further into my journey, but intentionally working to create a reality where that's not the case. And so,
mm.
as you said, the messy middle, I guess the point I want to bring up is, I'm still working as a pharmacist, doing this work with people that, the people I'm lucky enough to get to manage in a hospital setting. And, it doesn't have to be in this certain entrepreneurial journey or this business. It's everywhere that we get to interact with.
Absolutely. It's exactly where you get to impact people, and that could be online. That's what I love about entrepreneurship. I mean, you can have group programs, you could have courses, you can help people in a retail setting. You and I were just talking about that. I just did a 4 hour training, guys, and no freaking lunch break. And I
Yeah.
was like, they're like, yeah, you get 5 minutes here, 5 minutes there. I'm like, I'm pregnant. I need to eat. But anyway, so yeah, like implementing clinical services in a pharmacy, or even through a doctor's office, and managing patient through CCM or transitional care. There's so many different ways that pharmacists can use their knowledge, and I think that I love that. I never heard of like the messy middle, like, and as pharmacists we're like perfectionists, so
Yeah.
that's interesting. Yeah.
Well, and another thing to point out is, so right now I call myself, I'm a coach, and I'm a pharmacist and a MS warrior. I mean, those are kind of my 3 big identities that I feel equip me to help others. But I'm
Yes.
very clear, I don't act as anybody's pharmacist in those relationships. So I'm very much leaning in and I'm their coach. And so the perfectionist in us was, well, we spent this money, we spent this time, we got this doctorate. What do you mean you're going to go do something that's not using it? And the truth is, it's never not a part of us now.
Yep.
It's it shapes our lens. It shapes, when I approach a provider and say, I think I can really help your patients live a healthy and happy life using these lifestyle factors. I'm not claiming to be their pharmacist, but they see PharmD, and if we have that backing, it means we trust evidence-based medicine. It means value those good things. So if anybody out there is thinking, wait, but I've been a pharmacist, don't I need to keep doing that? Maybe not. Explore
Yep.
what that looks like.
Yeah, and I always say, and like if your parents, like I know my dad was like, "You're stupid. What are you doing?" Because like I left retail almost 5 years ago, and I haven't touched a pill. I haven't dispensed anything in 5 years, but like you said, I still use that knowledge, and it allows you to have that, first of all, that credibility, that base, and also be able to, like I said, use it in so many different ways and be creative with these
Yeah.
gifts that we were given, both innate gifts, but also what we learned in pharmacy school. So there's really no limit. I'm
Yeah.
like picturing the next book. Like you have to be in my next book.
Yeah.
It's gonna be
Or
like moving beyond the counter again or something. I don't
again, yeah, further behind the further beyond the but
know.
you're exactly right. Where in pharmacy school, we know we're going to do this long, hard thing, but we know every step. So we just set out and we take the next step and the next step. If you're interested in starting your own business or doing something, the same thing applies. It's going to be a long and hard journey. The difference is you don't have this roadmap, and that could be seen as a bad thing, or is it a chance for you to be creative and just make the roadmap yourself?
I was thinking of this topic this morning, and you just brought this up for me. So thank you for saying that. I keep saying to myself, I'm like, I don't know what I'm doing. Like, I'm pregnant for the first time. I'm like, I don't know what I'm doing. I don't know what I'm doing. And then I was thinking, I'm like, this is so similar to what I hear a lot of other pharmacists saying when they first start off, because it's the unknown. And I'm like, you know what? I might not know exactly what I'm doing, but I think I'm intuitive and like I'm going to be okay as I go through this journey. And so, using that, like a lot of you might be moms and it's the opposite. Like you're wanting to be now an entrepreneur. Yes, there's a lot of unknown, but also knowing, okay, you have that creativity, you have these things inside of you that, all right, I'm going to a breastfeeding class in a couple weeks. I'm going to get some
Yeah.
guidance. I'm going to figure it out. And that's
Yep.
okay. So I think too, even just saying, because like I heard myself start to say that, I'm like, I don't know what I'm doing. I don't know what I'm doing. It's like, yeah, but like give yourself some credit and like you're going to get some support. So,
Yeah.
I'm going
And
through it too. Huh?
yeah, and that's a super skill. A super skill is kind of knowing that you don't have to do it all alone,
Yeah.
and kind of getting excited that you do get to, you know, to get support where we need it. Because there are all sorts of. We don't try to cut our own hair. We don't try to
Yeah.
learn new things. It's like we get support where we need it. Like we're a tribe of people sharing their gifts, and everybody can lend their strengths in different areas, and really make magic happen.
Absolutely. Yeah. I wanted to, I was just like, I think I was like brushing my teeth this morning and I was like, I need to bring that up today at some point. So I'm glad that I did because, I've been doing this for 11 years and people are always like, oh my gosh, like maybe they're at like step one, but trust me, you have more than you have it. It's just getting that support and allowing some of these intuitive gifts or, your story, like, you were just saying you went through a really tough diagnosis and now you're able to help other people. So that's like you have it.
Yeah.
So I would actually
And
love to go ahead
no,
with something coming
go
up for
ahead.
you.
You called it a download. I love that. In the morning when I dump out my thoughts, I call it a thought download. But you said you got to download that this is what you need to do. And just a similar thing where once I was exposed to it, what this work is, helping with realizing that we can do things to be healthier, be happier. Same thing. It's like now I can't go back. I can't unsee it, and I can't stop this mission to help people do the same.
Well, and I think I always go back to like the levels of consciousness and awareness. It's like what you just said, you can't unsee it because now you know that, like, I wonder if I still have this chart. I do. You guys know I love this chart. Here, maybe this is easier to see. This is all about empowerment, right? And so this chart changed my life, realizing that. So David Hawkins measured through applied kinesiology, different levels of awareness. So when we reach courage, what he found was that anybody that calibrated energetically above this level, they had these self-affirming behaviors. So they were healthy, and they adapted all of the, like a healthy mindset, and they exercised and took care of themselves. And people below 200 had a lot of these kind of like a little bit of what you were saying before. I'm just going to minimize for a second. You were talking about how, like, whenever somebody goes through a diagnosis, right, it's a trauma, it's a shock. And so whenever we're in some of these, holding on to some of these lower frequencies of like shame or guilt, that affects how we show up in our health. And so what this is showing here is that, you know, you can get up to courage. You can get up to this level of awareness, this level of energy where you're empowered in your health and you're not a victim to, like, oh my God, I have this disease and it's always going to be like this. And just talking to you the few times that we have, I know that that's the work that you do with people. And I would love to hear, I know you had like, I think it was 6 different pillars or 5, I can't remember now, but that's a part of it. Because if we have these thoughts and like, oh my God, it's never going to get any better. Like, if you look at people with chronic conditions, they oftentimes have depression, anxiety, because it's like, where's the light at the end of the tunnel? So speak on that a little bit.
Sure. I mean, the framework that I use, it's also the name of my podcast. It's called the Habit Hub for Autoimmune Health.
Mm,
And I very specifically chose habit because it's a universal language that any big goal in any area of our lives really can be broken down to our daily habits on how to get there. And so habits are energizing, habits are studied in the science, not only the actual benefit of using habits, but also what the specific ones related to health are. And so the Habit Hub is a hub, also very intentionally, that it is a circle that one area can't outperform another area because it will be lopsided. And so spoke 1 is your mindset. So how are our thoughts and feelings creating what we're doing and not doing? And so depending on where we are with our diagnosis, we can spend a lot of time in mindset of really processing losses that come with a diagnosis, as well as reframing what life looks like and building up that self-efficacy, which just means your belief in yourself that you can impact some control.
right.
And so we have mindset. 2, as you can imagine, is food as medicine. When we're talking about our health, crap in, crap out, crap energy in, crap energy out, and vice versa. When we feed our body what it needs to, become the healthier version that we're coming into, then that's everything.
Yep.
3rd one is movement. So micro movement, macro movement. That is just a lot of people, if you're watching, you're like, okay, I know I feel better when I move, and really finding what are those barriers to us doing the things we want to do. The 4th is that R&R, I call it, rest and relaxation. So this is one I still am guilty of neglecting the most, really valuing rest as a productive act in favor of some of the other ones.
Mm,
5th is my favorite. If you can have a favorite child, it's connection. Connection with the world, connection with ourselves, connection with others. And then the last one is what I call good stresses. So recognizing some of these things that can feel hard in the moment, but we are coming back on the other side of it stronger.
mm,
And so around all that is just the habit of making and breaking habits, because if we're working on, let's say, the habit to cut out ultra processed foods, I'm going to give one that is very non-controversial because everybody gets to decide what they want to do, but you'll be tough to find someone who thinks ultra processed foods are helping our bodies. So if we're working on that habit, that skill of doing it in a way that feels good, that skill then picks up and we're able to use anywhere else on any other habit we want to build, because we're just building that
The
self
muscle.
efficacy. Yeah, that
Yeah.
belief that we can follow through on what we say we want most, not what someone else wants for us, what we want.
And that's true empowerment. Like that's what I was kind of showing before too with that graph, is that level of courage. That was the breakthrough point where people started taking ownership of their health and saying, I actually have control of, my internal environment.
Yeah.
Epigenetics talks about, I think it's like 95% of disease actually comes from, our environment, whether it's externally, internally, and that comes from our thoughts and everything that you just described. So, and I love how you highlighted connection, because I think there have been, I know, numerous studies too about, even with like a dog, like my dog's behind me right now. People who have a dog live 10 years longer. Why
Wow.
is that? All of these studies have been out, even, with like the elderly population. I remember reading something about that. Like, if, when they're not just isolated by themselves, they can thrive. And I know this probably has to do with the nervous system too, because, when we are connecting beings, we're meant to be in community with each other. So connection actually helps regulate the nervous system. So when you're venting to like your friend or something like that, you're actually regulating your nervous system. So
Yeah.
yeah, there's
Have
so
you
much.
heard the analogy, genes load the gun and environment pulls the trigger? Have you heard that
Yeah, yeah, yeah,
analogy?
yeah.
I'm like on a mission to debunk it, because that makes it a point in time that, the trigger's pulled and then, the damage is done. And in
Mm,
we the trigger can be pulled, we can get to the point where the symptoms reach a point where we have a diagnosis, but that doesn't mean that all of a sudden the environment doesn't have an impact. And so the analogy I love and I'm using all the time is like a piano. The keys are set, the number of keys, the black keys, the white keys, but the fingers that we use to play which keys in which combination at which tempo determines the music that comes out of that piano. And,
mm.
that's constant. That's every day after that diagnosis. So I really would love, if nothing else, for people to leave feeling, statistically, numbers up to 1 in 5 have autoimmune disease or a marker for autoimmune disease in this country. So it's impacting people all around us. And right now, I often am speaking to those with that diagnosis, but I would love if this message throughout the world could start before the diagnosis.
Mm. Well, we're gonna push this out, this recording out there as much as possible. So, um, this question just came through. It's not like, again, a download that came through, because I don't know why I see you speaking. Like, are you thinking about like speaking to different audiences or like groups or doctors, or I don't know. There's like something there.
That's interesting. I just spoke at my first summit,
Okay.
two weekends ago. So I was invited for, it's a nonprofit for MS, and I was on a panel with a physical therapist and a neurologist. Um, and yeah, I've been doing some other various speaking for um, uh, Dr. Walls's community, if anyone's familiar with her. But yeah, you picked up on that.
Yeah, I just was like randomly that came through as you were talking. So, because I could see that message really spreading and people needing to hear that. So,
And
yeah.
I'll say, this MS was my third diagnosis, so autoimmune. So I was diagnosed with vitiligo when I was in my teens, and then Graves' thyroid disease in my 20s. And those two didn't have the impact on me to change, to wake me up and say something is not right at the root, and
Yeah.
I need to do something different. And so a lot of people may be in that boat, with a diagnosis of Hashimoto's or a diagnosis of celiac or all the lupus. And it wasn't until there was a diagnosis in my mind that was tied to my independence and my mobility that I was like, whoa, What can I've got to do everything I can. And so I would love to be able to like instill that belief in every human, to start now, like, wait, what can I do? How is what I'm doing, my lifestyle in those six spokes, how is it hurting me and not helping me?
Mm. When you were talking, I just thought of there's kind of I would think like a universal fear of powerlessness, like the loss of control of your own body. Like even think of, Parkinson's. I have somebody that's close to me who has Parkinson's and he's very, very young, and but he had a very controlling personality all, growing up, and so now he has no control. And it's so interesting because I can feel that that would be so just like deflating for somebody to just say, I don't have control of my body. And so I know that you go into that to help empower these patients. I love that word self-efficacy because that's when they feel like, okay, I can wrap my hand, I can do this. I have something that I can do, whether it's like this through this habit hub, right? Like maybe I want to focus on nutrition today or, whatever that might be. And so I love that. I love that you help people in that way. And it's not just about like the functional medicine or like the food as medicine. It's very multi layered, it sounds like.
Yeah, I have to say, if I had to boil it down to one thing, it's just I would love people to decide they want to do something, have a belief that it makes a difference and follow through on it. So it doesn't even matter what the what is. People can come and want to eat a certain way. Now, I definitely share what the science says about various things, but everybody is so unique. I mean, we are ends of one, meaning we know that because we're pharmacists. We are an experiment with ourselves, and that is going to be better than any science out there. We can use that as a starting point, but then empowering us that we are the ones. It's frustrating when people want to do things for so long. Like for years, they've been saying, I wish I could just something, whether it's eat different, move more. I wish I could just, like, turning those I wishes into first I wills. So like gaining that confidence with yourself that you will, and then like I'm doing it. I am able to just show up for myself. That's what feels good.
Well, I want to bring this back up because this is exactly what you're saying with this chart here. So, like, if you look down here in these lower levels, this is when people feel stuck, when they're stuck in some of these lower frequencies of shame or guilt or um, even apathy. Like okay, so I'm going to call my father-in-law out. He doesn't have, he doesn't have like Facebook or anything like that. He's not healthy. I love him to death, but he's just like resigned about it. He has diabetes, it's uncontrolled, and he's in these lower frequencies where he's not motivated to go take a walk. He's an old man. He drives around. He goes and like, tries to get. We're here in Pennsylvania, and he's like excited about getting cheaper gas in Ohio. Like that's the highlight of his day. Like so. I bring that up as a concrete example. I love him to death, but I think that that's where it's the energy inside. Like you said, it's how does somebody get that momentum and that belief? Like yes, I can do that. What I've found and through my research over the past 11 years has been looking at releasing some of these things. And motivational interviewing is a great way to do that. If
Yeah.
somebody feels guilty about, their diagnosis, like, oh my God, what did I do? Like, did I cause this? All of that, like really looking at that and helping them sometimes release and
Yeah.
moving up that scale so that they are at that level of empowerment and they can go from the oh I don't care whatever to yes I will and I'm willing to do this. So
You nailed it. You nailed it because the exact same habit done with a thought and a feeling behind it, one being, oh, I need to do this, I feel pressured, and I do it, is going to be received by your body completely different than I get to do this,
yep.
feeling curious or hopeful in doing it. I always say it's kind of, it's like a garden analogy is an easy one where when you plant the seed of a thought and you nurture it and you feel good about it, it blooms. But if you just try to pluck a healthy plant, which is doing the habit, and put it in your garden, but you don't do what's underneath it to fertilize it, it doesn't last very long.
Yeah.
So anyone who when we start working together, we redefine a habit as a thought, a feeling, and an action. So behind every action that we're doing, which is what most people think a habit is, we uncover what we're thinking and what we're feeling before we do it, because the end result is huge. And you've probably heard the study of the two people, or one person was given something that they're saying was a health drink, and they said this is so healthy, it's full of so many vitamins and minerals. They drink it. Later they're given the same thing, but they're said it's a rich indulgent treat, it's a milkshake, it's high calories, and that absorption is completely different. The only
Wow.
thing changing is what the person is thinking and feeling while they're eating it. So there's examples like that all throughout it, and it's like, what is underneath it? Let's get to the root of that habit, which is the thought and the feeling, for sure.
Mm. Have you ever seen, real quick, that it was like an Apple experiment? I think I might have even I sent
I
it to
think you
you.
shared it with me. I want
Yeah,
to hear
because
it again.
so this was really cool. So I wish that I wonder if I could like pull it up really quick on Google, because I just thought it was such a cool experiment. So they had two apples, and they put just I don't even I think it was like I can't remember who even started it, but in one jar they said, I hate you, you know, you're ugly, all this like really mean to this apple. And then they said, I love you to this other apple. Like I think they spliced it in half. And when I tell you the difference, apple experiment, let's see if it comes up. You guys are going to see what this looks like. This poor apple that got hated on. The
Yeah.
one that had hate over it was all shriveled. Here we go. Danielle Laporte, she did that. I can share it here. I just think this is really interesting. Share screen. So this obviously the one on the left was the I love you, you're beautiful, whatever. On the right, look at how decrepit that is, right? So that just goes to show, and this has been done so many different times. If you just Google like Apple experiment, you guys will see this everywhere. So again, it comes back to our internal environment, right? So like kind of what Amy's saying is the thought, the emotion that creates our energy and how we show up and the things that we either do or don't do. And I think that
Yeah.
that's a really clear experiment for someone that's like left brain that really wants like show me the evidence. Show
Yeah.
me the studies. These aren't just things that we're talking about. You know, we've been studying this. I just think that's a really clear indication of how our internal environment affects our health.
And one more, just for those who do want the science. I mean, you can measure if somebody forgets to eat versus chooses to fast for the same amount of time, and their blood markers and what's going on are different because the thought and the feeling behind it are different. So, I mean, you're changing very little variables except for the mindset around it and getting these drastically different things. It's just,
Wow.
it's fascinating.
Yeah. Oh my goodness. I love everything we're sharing. We could talk all day.
I
Is
know.
there anything else that you just feel really passionate about or that you want to share with our audience? I know that you're going to share a little bit about your Habit Hub podcast. Anything else that's like just bubbling up and you're like, I need to tell you guys this before we leave today?
I would say, I would say that whatever that goal is, it can start today. And, whether it's related to moving something related to your career, whether it's your health, we always think that we're going to get to it when. And, time when we're doing good habits is our friend, and time when we're ignoring them is a detriment. And so I would just encourage you that figure out whether it's a person, whether it's support, whether it's something that you muster up inside, figuring out a way to start with tiny, I say trust in the tiny all the time, the tiniest of progress in whatever your one, two, or three priorities are. If you have more than three, you have none. I think that's a Jim Collins quote. So what is your top, maybe your top couple? And just start today. Start, do what it takes to start in the tiniest of ways, just to start marching forward.
I would love to hear. So tell me more a little bit about your podcast too, because I'm sure you go over a lot of these topics in your podcast. So if you could just, I know you're going to drop the link after after the broadcast here, but just kind of, um, like how long have you had I can't remember. How long have you had it? Anything else you want to share about the podcast?
So today was episode 22, so it's weekly. So we're coming up on half of a year, and each episode is a habit. So it's the what, the why, and the how. So again, for people who like a little bit of science, there's a little bit of story in there. There's what the science says to support it, and then how. So that's where a little bit of coaching comes in. I encourage you to kind of take what I talk through. I talk about different habit strategies to make it work. And then I always invite you, do you want to take this further? And these are the ways. I love that people can come in and get all the value they need just from the podcast. Some people say, "Ooh, maybe I do want to really work through this one that feels tough." But the habits are fun. I try to make them less than 15 minutes. I've been bringing guests on, which are awesome, both guest experts in certain fields to really give their perspective, but also other autoimmune warriors that want to share their thoughts. And it's I like to say it's a little community. Even if you're just tuning in and listening, and then you leave every episode with a do of the day. And so again, starting today, what is just that small thing you can do to work towards? And there'll be, not every habit's for you. We can't fill our whole day with habits left and right. You pick the ones that make sense for a reason, a season, or a lifetime, I like to say.
I love it. Beautiful. Well, I can't wait to go listen to some of those episodes. I'm going to go follow you now. Is it on Spotify too? Because usually I listen to Spotify.
It is. It's on all the podcast platforms,
Okay.
and would love to have you. And I just in today's episode, I said we spend a lot of time in the mindset spoke, and so I need to venture
That's
out
my
and
fault.
do a
Because
little
I
bit of
love that
travel.
stuff. Yeah,
Yeah.
sorry.
Well, it's such a proof that uh, that's where it all starts. And like you said, when people feel out of control, there is always something we can control. And sometimes just helping walk through where that is, and get our brain the task
Mm,
to find those things, then our brain is like, oh, it gets good at looking for what you tell it to look for. So what
right.
can we do?
Well, and I loved how you talked about even it could be that little micro shift of going from disempowered to hopeful. And like that's the shift for that
Totally.
episode or whatever it is that you're doing. Like those micro shifts eventually to me create a like a domino effect or a cascade effect that you're gonna get that momentum, you know?
Yeah, I'd say a couple of the most helpful emotions for any change you're about to make are curious and hopeful. And so any thoughts that you can borrow or practice that have you feeling curious and hopeful are going to serve you. I
Oh, I'm
mean,
gonna take that.
just, I think those are the most, when I really look at what are people thinking right before they start working with me? And hopeful and curious and excited are always the ones that I'm still that way. I still get hopeful and curious and excited. So
Oh.
the thoughts like, ooh, what's possible, or this could really work for me, whatever this is, really lean in and just practice those thoughts that have you feeling those good emotions.
Oh, I love that. You got me feeling emotion. I'm channeling Mariah Carey. I don't think I've ever sang on one of these.
I think I joined you for a minute. My go-to is Whitney. She's my
Yeah.
angel.
Oh, I remember being on a plane when I was, I think, 3 years old, and I had her cassette tape, and I was listening to "I'm
Oh
Every
yeah.
Woman."
Love it. Yeah, love it. Music. We're in the same age bracket too, so
Yeah.
it's nice. We're shared references.
Yeah. Well, you have been a joy. I so appreciate you coming on and sharing about how to create health and happiness, even with an autoimmune disease diagnosis. And, you just spread so much joy and hope. And I am definitely going to be sharing this everywhere so that more people can see it because I know so many people out there need this work. So thank you from my heart for doing this work because so many people are going to benefit from it. So
Thank you for everything you do, and I can't wait to see beyond the counter
yeah.
and uh, and figure out what that looks like. But no, your energy and joy and love is evident, and just really appreciate you.
Oh, thank you so much. There's the love going from heart to heart here. All right, everybody, we will see you on the last episode of 2023 because I don't think we're doing a December episode because it's around Christmas time, but we will be back with Kate Cozart in a month, and we're going to leave all of Amy's information on how to connect with her, the podcast, all of that good stuff in the comments. If you're watching on YouTube, we'll leave all that in the description box, and we'll see you on the next show.
Bye.